episode of More Than Great Tits and a Pretty Face. What do plastic surgeons do besides just boob jobs and facelifts? The answer to that is literally hundreds of things. I have a bunch of them written on pieces of paper in this bag, and we'll pick them out at random and talk about different surgeries that plastic surgeons do. All right, so a paniculectomy versus an abdominoplasty. A lot of people are familiar with plastic surgeons doing abdominoplasties. That's our tummy tuck, so let's get into the difference. Abdominal wall, looking from the side, I'll put a picture here, has multiple layers, and it goes from the skin to a more superficial layer of fat-containing fascia called our Camper's fascia, and then another layer of superficial fascia called the Scarpa's fascia, and then we're gonna move into the layers of our abdominal muscles. Before, you have your peritoneal lining, which contains all the organs inside your abdomen. Start with an abdominoplasty. That's a tummy tuck, and it's considered a cosmetic procedure, although it does have functional benefits. So we're gonna be removing some of that loose skin that often happens after multiple pregnancies or weight gain and then weight loss, or just with aging and we get laxity of the skin and sometimes have excess skin. We're gonna primarily be removing skin from the lower portion of the abdomen. The skin and subcutaneous fat are gonna be discarded, and what's remaining is gonna be pulled down to cinch and pull this abdominal wall tight again. We're gonna leave the muscular layers down. However, one of the parts of a tummy tuck is to do a diastasis repair. So particularly after multiple pregnancies, a patient's rectus abdominis muscles, which are our six-pack muscles that run up and down, start to separate. There's normally a tight line of fascia in the middle that connects the two, but that starts to get broadened. What we're gonna do in the tummy tuck procedure is sew those back together, and we call that application. We're gonna do a stitch that's gonna tighten those muscles back up, and it generally does help the function of the abdominals post-operatively. The other important thing to a tummy tuck procedure is that we're gonna do an umbilical transposition. The belly button is often in that skin that's pulled way down and cut off. Like the portion of your skin that you normally would contain your belly button would be in there, and if we didn't transpose it, you would have no belly button. So we create a new hole in the skin that used to be up here and is now down here where the belly button lies, and pull the umbilical stalk through, sew it in place, and give you a cute new little belly button. A paniculectomy is a slightly different procedure, and it generally is covered by insurance. But by definition, a paniculectomy is ectomy, removal of the paniculus or the pannus, which is an overhanging skin that tends to happen in patients that have had massive weight loss. So by definition, that surgery for what insurance is trying to cover here is just the removal of the hanging pannus that causes things like rashes and mobility issues. So what makes a paniculectomy different than abdominoplasty are the things that the insurance companies consider non-medically necessary, which I'm not so sure I agree with, but in a paniculectomy, the diastasis or muscle plication, where we sew back together your muscles that have separated, is not included, although some surgeons do offer this as we can submit your paniculectomy to insurance and then you can just pay an additional fee for the diastasis repair. And the umbilical transposition is also not included as part of the medically necessary paniculectomy surgery. So a true paniculectomy is to just remove the overhanging skin and nothing else. A lot of times if you go to a plastic surgeon, we'll work to try to pull down and tighten as much of that skin as possible, and possibly, depending on your surgeon, give you the option to pay out of pocket for the umbilical transposition and the muscle plication if you would wish. If you don't meet those insurance criteria for what is a paniculectomy, then generally if you want this procedure, you're gonna be looking at an abdominoplasty, which is an out-of-pocket procedure provided by most plastic surgeons. As always, if there are other topics that you would like to learn about in plastic surgery, drop them in the comments and I'll try to make a video.